Hey there, everybody. My name is Wes Godfrey. I'm one of the geriatrics fellows at Mayo Clinic. I want to thank Laura Magnabosco, Richie Shu for helping me, my co-fellows. We're talking about high sensitivity cardiac troponin I today and its use in older adults. I think as geriatricians, we certainly think about cardiovascular disease and risk factors for our patients. And I think one of the things that we want to kind of highlight with this article is that the pooled cohort equation that we commonly use for ASCVD risk calculation technically only goes up to age 79. So the question of, what do you do with somebody who's 80 years old and older, or especially if they're very functional and certainly have reasonable prognosis and in terms of their 10-year mortality. I think discussing what risk stratification approaches we can take would be helpful. And that's what this article tries to address. Um, this is the epidemiology. I think all of us are well aware that this is a major issue for our patients with age, in and of itself being considered a high risk factor after the age of 65 and 71 for the respective genders, um, putting you at risk for cardiovascular disease and mortality. So this article, high sensitivity cardiac troponin I for risk stratification in older adults, comes out of Hopkins and Baylor, among other colleagues, and it's from the ERIC study, which really, was designed. It's a cross sectional and it's an observational study, prospective cohort with a design to really try to get to the bottom of what it is that goes into cardiovascular risk. And this is a sub-analysis from that greater study. Um, you can see the design there. It took about 5,000 plus older adults with a mean age in the mid 70s range. And using these new assays of high sensitivity cardiac troponin I, compared to the prior assays, T or high sensitivity C-reactive protein or a number of other pro-BNP that we think about for heart failure and other indices. It tries to bring this all together to say what can we predict in terms of mortality and incident cardiovascular disease for our patients. Um, there are a number of different definitions. I tried to put them here, and you can pause the video and refer to these because I tried to break it down a little bit based on what the authors have shared, but I'll skip them for the sake of time here. I think that this table one shows that for the most part, the folks that they looked at are fairly similar. You can see some differences across low, moderate, and elevated risk categorizations, which I think is expected, and then they compare to those folks who they have already known prevalent global cardiovascular disease at baseline. Um, so I think these figures sort of have the meat of the article. You can see that when categorized using this high sensitivity cardiac troponin I as an independent risk factor, using the three categories stratified by gender, low, moderate, and elevated, you can see that all cause mortality in and of itself, it predicts that with a pretty significant hazard ratio for both men and women. And this is even greater than those with prevalent cardiovascular disease at baseline. You can see that this kind of goes across individual outcomes, including chances of getting or having global CVD, atherosclerotic CVD, or heart failure in and of itself. And then this table is pretty interesting using C statistics, which I learned a little bit about as part of this presentation, is a concordance statistic. And you can see that when comparing the high sensitivity assay that they're testing here to CRP and pro-BNP, it's negative, meaning that the area under the curve is less for these models compared with using the high sensitivity assay. It increases that C statistic and reliability. So I think in summary, the cardiac troponin T is found both in cardiac and skeletal muscle. And so the advantage of this troponin I is that it's specific to cardiac only muscle and can be helpful in predicting not just all cause mortality, but also can be helpful in predicting incident cardiovascular disease in our older patients. There are some limitations of this study, of course, including Abbott sponsorship of the assay itself with some of the authors, and the fact that it's an observational study, a prospective cohort, but I think it does have some merit, and I'm excited to see what everybody says about it during our journal club. Thanks, everybody.